All right, I think we're going to go ahead and get started now. Hi, everyone. My name is Tess Killian, and I'm so happy to welcome you to the 5th annual Cannabis in Practice webinar series, hosted by the Washtenaw County Health Department and Livingston County Health Department in partnership with the Washtenaw County Medical Society and Livingston Physician Organization. This webinar series is aimed at addressing questions our local and regional healthcare providers have about cannabis use and their patients. Our speakers come from a wide range of backgrounds and are experts in their respective fields. Funding for this series comes from the Michigan Department of Licensing and Regulatory Affairs Cannabis Regulatory Agency. This webinar is being recorded. The webinar recording and presentation slides will be available on our website, washtenaw.org/marijuana, in the coming weeks. Before we get started, we ask that all questions for our speakers be asked through the Q&A function, which can be found at the bottom of your screen. We'll have time at the end of the webinar for the speakers to answer questions. I am pleased to introduce today's speakers. We have Biyyiah Lee and Kristine Walton from the Midwest CannaNurses. Midwest CannaNurses is a collective of registered nurses from various backgrounds in healthcare and academia that connect cannabis and healthcare by offering educational resources, encouraging informed consumption, advocating for patients who use cannabis, and developing individualized care plans for holistic treatment. Biyyiah Lee is a Chicago native and a current registered nurse in Detroit, Michigan, with over 12 years of nursing experience in a variety of nursing settings. She is a member of the American Cannabis Nurses Association, Society of Cannabis Clinicians, and Minorities for Medical Marijuana. She is a proficient and active cannabis advocate with a master's degree in advanced public health nursing and practices where cannabis and public health overlap. She is a 2021 Ambrose Scholar with a focus on cannabis education policy. To date, she has taken part in several state and city-run initiatives related to recreational marijuana implementation and related social equity considerations. Biyyiah has also obtained a certificate as a medical cannabis consultant to further her efforts in promoting the safe and effective consumption of cannabis. She has been recognized as an emerging nurse leader for her cannabis education and advocacy by the National Black Nurses Association and the Illinois Nurses Foundation. Lastly, Biyyiah works to educate and mold the next leaders in healthcare and cannabis as an adjunct faculty member at Pacific College of Health Sciences Medical Cannabis Program and Wayne State University College of Nursing. We also have Kristine Walton with us from Midwest CannaNurses. Kristine has 20 plus years of nursing experience. She has earned her bachelor's in science in biology from Alma College, Bachelor of Science in Nursing from Wayne State, and obtained her master's in advanced public health nursing from Wayne State in April of 2020. She began her journey in cannabis nursing to bridge the gap between traditional and holistic methods to health and wellness. She earned her certificate as a medical cannabis consultant through CanZoom and is an affiliate for Balance Relief. Kristine has presented at Women in Cannabis at Birth Detroit, PAHM Conference in Lansing, Annual Canna Summer Wellness Summit, and Canna Curious in Grand Rapids. She has been featured in Voyage Michigan Magazine and is a member of Cannabis Nurses of Color, American Cannabis Nurses Association, and Cannabis Nurses Network. So now I welcome the CannaNurses. So thank you so much for joining us today, and I will start sharing your presentation and you can take it away. All right, just let me know if anything needs to be changed with that.
Awesome. Okay. Alrighty. Thank you, Tess, for that wonderful introduction, and good afternoon to everyone who has joined us today. We're really excited to get this conversation started. First things first, we're going to ask if you could please complete our pre-test survey just to gauge where you are and your information about cannabis. And then after we finish the presentation, we're going to talk about the therapeutic uses of cannabis today. And once we get through our slides, we're going to do a post test. And if you could let us know how effective our information has been, we would greatly appreciate it. So you can scan the QR code that's here on the screen, or the link has also been dropped in the chat. You can do that. There are about 11 questions once you enter in a little bit of demographic information, so shouldn't take a bunch of time. And we're actually going to get started with going over some of the preliminary information and objectives while you all are in the background doing the pre-test. All righty, next. Perfect. So we already learned a little bit about who the Midwest CannaNurses are. As Tess said, we are a group of registered nurses that have a bunch of different backgrounds. I am most passionate about public health and academia, making sure that us as healthcare providers are educated about medical cannabis so that we can pass that information along to our patients who are consuming cannabis to make sure that they are having an informed experience. We have nurses whose backgrounds are in community health. We have folks that work with seniors and the veteran population, folks who focus specifically on chronic pain and sickle cell disease. And my wonderful co-partner here, Kristine, has an extensive background in women's health and works a lot with that population in navigating through cannabis. So we bring a wealth of different experience to the table. And all in all, our goal is to make sure that the patients who are choosing to consume cannabis are doing so in a safe and informed manner. All righty, next slide. So what we hope for you to take from this presentation today is just a general increase in knowledge. We want to make sure that you are knowledgeable about the endocannabinoid system, which gives us the basis of why cannabis works in our bodies in the first place. We want you to know about the various components of the cannabis plant so that when you hear about them and when your patients are talking to you about them, you know how to have a discussion with them. We want you to learn about the medical indications of cannabis use. And I do want to preface this and say that, you know, we have focused on the parts of the indications that are supported by scientific evidence. However, what we want you all to acknowledge is that cannabis has been a patient-led movement, right? So a lot of the advances that we've seen in the cannabis industry have not come traditionally from the science that we've been able to draw up. It's actually been coming from the anecdotal experiences of our patients. So we'll give you a little bit of both of those sides of things so that you can take that information to best inform your practice. And along with that, we'll talk about a little bit of the practical considerations and how we envision you putting this new knowledge to work in your everyday interactions with patients. All righty, next. All righty, so there's a lot going on in this slide. We want to talk to you about the history of the therapeutic indications of cannabis. And this is very important because what cannabis started off as in our prehistoric times back in China is not necessarily what we know them to be today. So to kind of merge the two time periods is our goal in presenting this history. So without further ado, cannabis is a plant that's native to Central Asia. We saw it about 5,000 BC. They had a lot of documented practices for it and even had a formal pharmacopoeia that explained its medicinal uses. Some 2,500 years ago, we discovered what they coined to be known as a Siberian ice princess. And it was actually a mummified lady that was discovered that had been suffering from a bunch of things like metastatic breast cancer and osteomyelitis. And we were able to study these remains to show that she had actually been medicating with cannabis. So that's the start there in China, but cannabis migrated around the globe, starting in India, going to the Middle East, making its way to Europe, and eventually finding its way to the Americas. And this slide shows a bunch of different ailments that each region used cannabis for. But generally, we saw cannabis being used for things like epilepsy, for rabies, anxiety, rheumatism. They were treating congestion with respiratory conditions, some depression, arthritis, labor pains, some of the things that we actually see cannabis being approved for today. Now, despite the existence of consistent and extensive literature about medical cannabis utilization in multiple pharmacopoeias, of course, we mentioned that it was in China, we mentioned that it was in India's pharmacopoeia, this knowledge poorly translated to English. So we see that poor translation come in right around when cannabis hit Europe. And this created a deficient historical background and understanding for Westerners about the benefits, the medicinal benefits of the plant and how it was used for therapeutic purposes. Because of this, when we got to Europe, cannabis was mainly used for industrial purposes. We did see a little bit of that use for like insomnia, neuralgias, for example, but it was primarily used for maintaining the fleets and ships and ropes and sails and such. And that actually brings us to how cannabis got to America. In the 1500s, the slave trade facilitated the migration of cannabis plants to the Americas. And in the beginning, some of those medicinal practices did transfer over with it. However, just kind of the same thing that's going on today. We had a lot of varying political agendas. We had, at the time, it was in the U.S. pharmacopoeia for treating a bunch of ailments like gout, anything inflammation related. We had a bunch of formulations of cannabis to be used for it. But then we saw those political agendas come in. We had the Marijuana Food and Tax Act and some of the other things that became known as stigma related to cannabis. And after about 100 years, it was removed from our pharmacopoeia. And that's officially when we started the erasure of the medical and therapeutic benefits of the plant. Alrighty, next. So this slide, we're going over the endocannabinoid system, and this really gives us an idea of why cannabis works in our body in the first place. It's because of this unique system that was discovered right around 1988. And this system is composed, it's a receptor system that's composed of endocannabinoids. Now, endocannabinoids are endogenous, they're made within our body, lipid-based neurotransmitters that bind to the receptor sites that are in the endocannabinoid system. And we see these receptor sites throughout our central nervous system, including our brain and our peripheral nervous system. So you'll see this figure, the light blue and dark blue dots, that gives us an idea of how these receptors are distributed throughout our bodies. Now, this endocannabinoid system is like a master regulatory system, and it's involved in almost every biologic function in our bodies, including sleep. It also affects our mood, it affects our immunity, it affects things like appetite, pain, memory, and so many more functions. Generally, the endocannabinoid system aids in the regulation of our overall physiological homeostasis or wellness by modulating all other systems. So you'll see here how it's spread throughout the body. It impacts our respiratory system, our circulatory system, our digestive system, even because of the way that these receptors are distributed. All righty, next slide. All righty, so we're going to get into a little bit more depth here about these receptors. The two main receptors that have been identified thus far, we know as the CB1 receptors and the CB2 receptors. The CB1 receptors are mostly found in the central nervous system. So those are the ones that you see are most heavily concentrated in our brain. And then our CB2 receptors are found throughout our periphery. Now, when we think about these receptors, because they naturally exist in our bodies, regardless of whether we're consuming cannabis or not, there's got to be something that's activating these receptors, right? And those are where we get into what's called the endocannabinoids, those endogenous cannabinoids. And we have two main ones that we know of. We have anandamide, which is listed up here, which is known as our bliss molecule, and that's often mimicked by THC. So if you think about anandamide and it causing bliss and uplifting, some of those same properties happen when THC is consumed. And if you think about the psychoactive effects that THC causes, you'll see that those CB1 receptors that interact with THC are heavily concentrated in our brain. So we start to put together the pieces of why we have those psychoactive effects when we consume THC. And then there's our other endogenous cannabinoid known as 2AG, that we'll find circulating throughout our body as well. Again, we have those high receptor concentrations in our brains. Those are the parts that control our motor activity, our thinking, our coordination, our appetite. And depending on your disease process, these are sites that you want to target to produce specific effects. Same thing with the CB2 receptors, like the ones that are in our digestive system, for example. There are cannabinoids that can be consumed that will change the gut motility within our digestive system because of where those receptors are located. Alrighty, next. Okay, so we talked about endogenous cannabinoids. Those are the ones that exist in our bodies naturally. Now we have what are called phytocannabinoids as well, and those are the ones that we are able to get from the cannabis plant. One of those major cannabinoids that we know about within the cannabis plant is THC. We first started learning about it in 1941 when we discovered that it had those physiological effects for us. We know that THC is a partial agonist of those CB1 receptors, so those receptors that are heavily concentrated in our central nervous system. And that's where we get to see the effects that THC has, like its psychoactive properties, its ability to provide analgesia, mood altering, for it to stimulate appetite, for it to suppress nausea. In low doses, it can be an anxiolytic, something that helps us with our anxiety. There are formulations that have been used for folks who are battling with epilepsy or spasms in the case of like multiple sclerosis, for example. These are all of the indications or the processes that go on in our body that THC mitigates. Alrighty, next. And then, of course, we have CBD, another major cannabinoid that we are familiar with. This was first isolated at the University of Illinois in 1940. We know this one as our non-intoxicating cannabinoid, right? Because the consumption of this will not cause those psychoactive effects. It won't get you high, quote unquote. And it does not fit directly into any one of the receptors. However, it does have an effect on those receptor sites nonetheless. We see CBD, it's a huge anti-epileptic for those folks with seizure disorders that are resistant to our traditional treatment. CBD may be a good option for controlling those. CBD is also a wonderful anti-inflammatory. We have some evidence that says it's an anti-tumorigenic. So sometimes or in some cases, we've seen that it inhibits tumor cell growth, whether that's, by cutting off blood supply or whatever have you to those tumor spaces. We also have that it's immune modulating. Again, we have those inflammatory processes that pop up. And then last but not least, we have those anxiolytic properties that CBD can provide and alter our mood a bit as well. Okay, next slide. So we talked about THC and CBD a little bit. Those are the major cannabinoids that we know about. However, over time, we've discovered other cannabinoids that have effects on our body. We normally refer to these as the minor cannabinoids, but here you can see a small table, and across the top, these are the various minor cannabinoids that you may see on the market with products. And then you'll have the benefits that they provide too. So THC and CBD obviously are the most accessible and the most studied cannabinoids. However, depending on the ailments that you're trying to treat, these other cannabinoids may come into play. So for example, on the market right now, you'll see a lot of products that are advertised for insomnia to help folks sleep. And generally, we see those products typically contain the cannabinoid CBN, right, which we see in the middle of the screen here, that cannabinoid helps to aid sleep. So the idea here and what we want to consider is that these cannabinoids, they act synergistically, they act together to boost the therapeutic effects of a single compound. So with that being said, products that contain whole plant profiles with more cannabinoids and also terpenes may be more beneficial than those with limited profiles. And then Tess, would you click for the next thing to come up? So this graphic here that comes up really gives you an idea of that web and network of how all the various components of the medical cannabis come together. So we've got those cannabinoids that we've talked about, and you'll see that each product or each strain of cannabis has its own unique profile, but it also has things called terpenes in them, which gives the product its aroma. And terpenes are naturally found in fruits, vegetables, on trees. Certain insects and flowering plants also have them, and they have a variety of characteristics, not only smell, but we are also learning that they have therapeutic benefits themselves. So when we're thinking about terpenes, we often compare them to like essential oils, for example, how we know that lavender has calming effects, and certain citrus fragrances, may be mood boosting. So it's the same idea and concept when we're looking at cannabis. And I will say too, we have emerging evidence about this, but the complete medicinal value of terpenes is still being studied at this time. All righty, let's continue. Okay, so when we talk about what cannabis is used for, this is where we kind of get into splitting up what our scientific background says versus, what folks are anecdotally using cannabis for. So at the top of this, you'll see, I want you to think about this slide as like a funnel almost. So at the top, what you'll see here is all of the conditions that the state of Michigan has approved for medical cannabis. If you have one of these and you have a medical record to show them, there's a good chance that you'll have a provider that will certify you for the medical program. However, when you look at this report that the National Academy of Sciences, Engineering, and Medicine put together, they say, hey, we don't have adequate information to support a lot of these diagnoses. And a lot of that has to do with the federal status of cannabis and us not being able to study as much as we would have liked. So what we end up with is what's down at the bottom. These three conditions are the only conditions that this report says we have sufficient evidence to support. So we say in chemotherapy-induced nausea and vomiting, oral cannabinoids are effective antiemetics. With folks with chronic pain, people who were treated with cannabis or cannabinoids are more likely to experience a clinically significant reduction in those pain symptoms. And last but not least, in adults with multiple sclerosis, related spasticity, short-term use of oral cannabinoids will improve those reported spasticity symptoms. All righty, next slide.
Okay,
So now we're just going to do a quick review of those three conditions that Biyyiah mentioned. The first one is the chemotherapy-induced nausea and vomiting. It's been found that the ECS inhibits emesis by the activation of CB1 and CB2 receptors in the dorsal vagal complex in the brainstem. THC is thought to act as a 5-HT3 receptor antagonist, thereby reducing the feelings of nausea for people. And then CBD is thought to improve the efficacy and tolerance of THC. It's also been found that synthetic cannabinoids were more effective than the dopamine receptor antagonists like Reglan or Compazine, which were traditionally the first line of treatment. So when it comes to dosing, the usual dose is a 1-to-1 ratio of THC to CBD. And usually the pill contains about 2.5 milligrams of THC CBD that's taken 3 times a day. And then another method is the oral mucosa spray. This is also a 1-to-1 ratio. And patients can use it, like they can self-titrate it. And usually they use about 5 sprays a day, which equals to be about 12 milligrams of THC that they use per day. Okay, next.
All righty. So when we are thinking about chronic pain, we have to understand that cannabinoids are uniquely positioned to mitigate various types of pain and all of its complexities because these receptors are widely spread across numerous pain modulating pathways. So you'll see some of those here, our central and peripheral sensory neurons in our brain regions, modulating sensory discrimination, our pain regulatory circuitry in our brainstem, and also those affective states that regulate our emotional responses to that pain. So there are cannabinoid receptors along all of those various pathways that we can activate to help us in how we perceive our pain and treating our pain. You'll see this picture here, and it kind of gives us the idea that trials show that analgesic efficacies in chronic pains were most likely modulated by all 3 cannabis chemotypes. So when we're talking about those, we're talking about either THC or CBD alone or a combination of them both. So this picture represents a living systematic review looking at 22 random control trials that found evidence that whole plant THC CBD products, so a product that has both of those cannabinoids, they have a positive effect on pain response, pain severity, and overall functioning as a result of pain. In addition, early research indicates that there's a possible synergy between CBD, THC, and opioids. And essentially what that means is it allows for combined analgesic effects using the THC and CBD while reducing the dosages of opioids and also reducing those the risk of adverse effects related to taking those opioids. All righty, next slide.
So what's exciting is that I hear a lot of providers say, well, I have a lot of patients on opioids, but I don't know how to incorporate cannabis to decrease the use of opioids. So there was a guideline that was just published this spring. It's called the Clinical Practice Guidelines for Cannabis and Cannabinoid-Based Medicines in the Management of Chronic Pain and Co-Recurring Conditions. And what they did is that they took a review of all the research that's been done on pain, and they provided recommendations based on strong evidence with people experiencing chronic pain and comorbidities. For example, if you have a patient that has chronic pain due to HIV-related symptoms, they give you recommendations, how strong the evidence was, and how to actually incorporate dosing into that specific diagnosis. They gave recommendations for chronic pain with migraines, with fibromyalgia, MS, epilepsy. So it's a very nice detailed article. The There's two different treatment protocols that they also utilize. The first one on the left is by Basker et al. And it's actually 3 dosing regimens based on clinical criteria. And there's a routine dosing, a conservative dosing, and the rapid dosing. And what they tell you is that with the routine or conservative dosing, they recommend starting off with a CBD dominant medical cannabis plant, and then with slow increases of CBD. And then it will guide you into telling you when you want to add THC to obtain the optimum pain control. If the patient starts complaining of adverse effects, they'll also tell you, guide you on how to titrate the THC to get the lowest, most effective dose for the patient. The rapid dosing is recommended for patients with severe pain, terminal illness, or those already using medical cannabis. And then the guideline on the right is kind of similar, but it includes how you want to screen the patient first, how to initiate cannabis, and how to titrate the doses. When you may need to taper the THC level, and then how to achieve the optimum maintenance dose for your patient. Next, please. So another most widely accepted use for medical cannabis is MS. MS is a degenerative neuroinflammatory disease that affects our central nervous systems. The two main symptoms are spasticity and neuropathic pain. And how cannabis can help is that the THC is shown to reduce the spasticity, and the CBD is shown to reduce inflammation. As Biyyiah discussed with the entourage effects, we have found out that the THC and CBD combination is the most effective in reducing these symptoms than each cannabinoid alone. There is an oral mucosa spray called Sativix, which is derived from the cannabis plant. It is not yet available here in the US, but it is currently prescribed throughout the UK, Spain, Germany, Canada, Denmark, Norway, Israel, Austria, Poland, Finland, Sweden, and Italy. So what it does is that the patients are able to self-titrate for symptom relief throughout the day. They found that the most common dose that people used was 12 to 15 sprays a day. Each spray contains 2.7 milligrams of THC and 2.5 milligrams of CBD. So what this basically equates to is that patients were using 30 to 40 milligrams per day in divided doses. And the studies have shown that the treatment is effective up to 13 weeks follow-up, and even benefits are seen at a 1-year follow-up. Next, please. So epilepsy is another widely accepted indication for medical cannabis. How this helps is that CBD may reduce neuronal excitability and transmission that leads to seizures. And then its anti-inflammatory effects may also be involved in the anti-ictogenesis. So the minor cannabinoid THCV acts as a neural antagonist at the CB1 receptors. So the most studied childhood seizures disorders, such as these Dravet and Lennox-Gastaut syndromes, have been treated with medical cannabis. Usually this medication is a high CBD to THC ratio. It's usually greater than 20:1. So the most common dosing starts at 2.5 to 5 mg per kg per day and divided into 2 doses. After 2 weeks, if there's no symptom relief, then you can titrate up to 10 mg per kg. And then you keep titrating until there is symptom relief. The max dose is 20 to 25 mg per kg per day. Other methods of consumption for epilepsy includes the oil-based capsules, the oral mucosa sprays, the sublingual, and there's also a transdermal patch. But I do want to say that the patches have found to be less effective and more costly for patients. Next, please.
All righty. So when we're talking about other widely accepted indications of cannabis, HIV/AIDS definitely comes into play. And while that wasn't included in that NASEM report, the reason why we wanted to talk about it here today is because we do have some FDA-approved medications that specifically are for HIV/AIDS, and we'll get into those in just a second. But generally, if you think about the benefit that cannabinoid could have on this disease pathology, like HIV/AIDS, we're thinking about the analgesia, right? Any pain control that it can provide, general anti-inflammatory, antiemetic, right? If those folks experience nausea, consuming cannabis would be great for that. We often see folks with HIV/AIDS experience anorexia and weight loss. So introducing THC that will stimulate their appetite may be great as well. And then in addition to just generally increasing the mood and energy of the patients is something that we'd be turning to cannabis for as well. So when we're talking about HIV-associated inflammation, we know that those CB1 and CB2 receptors are involved in the mediation of inflammatory pain. And it also helps decrease certain biomarkers that are associated with neuropathic pain. And it also acts as a CB2 receptor agonist. So we have the lower likelihood of that neurocognitive impairment that comes with the progression of HIV to AIDS. Thinking about those pharmaceutical THCs that we have, our dronabinol has been shown to be beneficial for anorexia and weight loss. And similar to the formulations that Kristine went over for epilepsy and multiple sclerosis, we're seeing cannabis being consumed in those small amounts, in those 2.5, 5, 10 milligram oral preparations, and even some oral solutions. Again, when we're talking about the sedatory effects of THC and even CBD in high doses, we see that it's effective for sleep. And then last but not least, we're talking about it having a potential on reducing the viral load of HIV itself, because it inhibits the replication of those cells. So generally, we see a lot of potential benefits, health benefits for using THC, CBD, or a combination of both in HIV and AIDS. All righty, next slide. Okay, so this is some of the synthetic cannabinoids that we have been talking about. They generally are very expensive, is kind of what I want you to take away from here, and that they have more side effects than consuming the regular cannabis plant or whole plant itself. So we have dronabinol, also known as marinol or syndrose, and then we have nabilone, also known as sesamet, that mimic THC. So if we think about the pain reduction, if we think about the appetite stimulation, you'll see that's why those medications are indicated for anorexia and weight loss that are associated with AIDS, for chemotherapy-induced nausea and vomiting. Dosages are similar in those 2.5 to 5 milligrams in starting, but we'll see that there are a bunch of side effects that are experienced a lot or experienced by most of the patients. And we'll get into a little bit of the adverse effects of cannabis later, but we want to note here that we are generally seeing more and more severe adverse effects when we consume these synthetic cannabis products, as opposed to the natural plant itself. And then, of course, the formulations and costs that we have available, we'll see it's very expensive to afford these FDA-approved synthetic cannabis medications. So I know that a lot of times as healthcare providers, we have an affinity to, looking at things that are FDA approved, for example, as opposed to, you know, sending someone to the dispensary that may be in their neighborhood. But that is something for us to consider, the actual cost of introducing cannabinoid therapy and how that will or will not be maintained by the patient, because as we currently stand with cannabis's federal status, it is not covered by insurance. Alrighty, next slide. Okay, so getting into our routes of administration, there are several things that we'll see on the market today and how patients can consume their cannabis. What we're most familiar with is that inhalation method and/or smoking. It does have the fastest onset, but it also has the shortest duration. So when you inhale cannabis, typically the effects are felt within 5 to 10 minutes, but they also disappear faster as well. We have our oral consumption. These are most often on the market as edibles in whatever form, whether it's a liquid, a gummy, a cookie, for example, and those are absorbed through our GI tract, our small intestine. They have a much longer onset. That's why, folks, if you'll see the packages that are available in the dispensary nowadays, onset is anywhere from 45 minutes to 3 hours, and those effects can last up to 8 hours. We have a sublingual, which goes under your tongue, or it can also be buccally between your gums and your cheek, absorbed via the arteries and mucosa. This does have a little bit of a faster onset because it's absorbed directly into the bloodstream, a little bit longer duration that we see similar to edibles as well. Then we have our topicals, which are our salves, our ointments that can be applied directly to the skin. Those are usually used for local relief. Folks with joint pain, arthritis typically use those topicals. Onset varies, duration varies with those, similar to the transdermals, very similar. Transdermals are very similar to the topicals. We see transdermals in the forms of patches. So think like a lidocaine patch. And this does have the potential for it to be absorbed into your bloodstream, whereas the topicals do not. And again, we have variable onset and duration with those. And then another newer way of in getting in that medical cannabis is via suppository. So we have both vaginal and rectal suppositories that can be used, and they have that quicker onset because it's being absorbed within our vasculature, and they also have a little bit of a longer duration. Alrighty, next slide. Okay, when it comes to dosing and titration of cannabis, generally there's insufficient evidence to support people starting their medical cannabis journey with those synthetic products that we went over a while before. We have research that shows that the whole plant itself is the safest profile for folks to start with if they can legally obtain cannabis in their state. So when we think about how the dosing works in our body, cannabis is biphasic in nature, which means that it has different effects at low versus high doses. So if you look at the example, as cannabis and the THC dose increases, there's a point of optimal benefits. Yet, as the dose increases beyond this point, what we know as the sweet spot, those benefits decline. So essentially with cannabis, for many patients, less is really more. We adopt this concept of microdosing, which means that we start with very, very low doses until our desired effect is reached. That desired spot or that dosage is known as our sweet spot, and we don't increase beyond there unless something changes with our general healthcare picture. So we'll look at CBD, starting that in doses of 5 to 10 milligrams. And we're going to go all the way up to 50 milligrams before we consider it not effective and or adding THC into the picture. with THC, because it does have those psychoactive effects, and a lot of people are a lot more sensitive to it. We started a much lower dose. So we're saying even a half a milligram up to 3 milligrams of THC, and then you'll increase that until you either reach your benefit, your sweet spot, or before you or when you experience adverse events, then that's how you know you've either achieved your sweet spot or need to dial back, titrate down a little bit to get rid of those adverse effects that you're experiencing. Okay, next slide.
So we are going to quickly review some other indications for medical cannabis. With these, the research is not as abundant as the ones we've reviewed already, but this is, however, where the patient's testimonies come in and that they are very plentiful. So some of these other indications are behavioral health, which we're going to get into on the next couple slides, women's health concerns, such as dysmenorrhea, pelvic pain, postmenopausal symptoms, and because this is my passion, what is so fascinating is that when you look at CB2 receptors, CB2 receptors are most prolific in the the female reproductive system. So this is why cannabis can be so helpful in this emerging area of women's health. It also helps with anorexia, ADHD, autoimmune disorders, glaucoma, and cancer. Next slide, please. So when it comes to mental health and cannabis, many people are already self-treating themselves with cannabis, especially since the pandemic. And what is fascinating is that research has identified these neurotransmission systems involved in our mood regulation. And one of them is the endocannabinoid system. We've talked about how CBD is shown to display anxiolytic, antidepressant, and antipsychotic properties. It's also been found to act on more than 65 receptor targets, such as the serotonin receptors, which we know are key players in anxiety and depression. CBD also acts on the mu and delta opioid receptors and the dopamine receptors, which makes a strong suggestion for its antipsychotic effects. In a study, they had patients that were at high risk with high risk or had schizophrenia, and CBD improved positive psychotic symptoms, the increased cognitive performance and overall function, and that the side effects that you see with traditional antipsychotics, such as the extrapyramidal symptoms, the cardiac, and the hepatic function, they was not evidenced when patients use CBD. Next, please. Next slide, please. Another condition that people use cannabis for is insomnia. We know that the current pharmaceutical medications have adverse effects such as cognitive impairment, weight gain, metabolic syndrome, and addiction and dependency. What's nice, as Biyyiah mentioned, was that THC has a biphasic effect on sleep, meaning that lower doses of THC is associated with a quicker onset of sleep and an increased sleep time. But if you get a too high dose of THC, then it's shown to reduce your REM sleep. And CBD, again, has that same effect on sleep latency. But this time, lower doses of CBD has stimulating effects, while the higher doses are more sedating. So they have done various studies using just CBD only, the different combinations of THC and CBD, and the most effective was the higher ratio of CBD to THC, such as a 2-to-1 or higher. And then another cannabinoid that has been found to be effective in relieving insomnia is the CBN. So people want to be looking for those products that have that higher CBD, CBN combination with the lower THC ratio. Next, please.
Okay, so when we talk about side effects or adverse effects from cannabis, these almost always result um, from overindulgence, right? We have either consumed too much cannabis in a short amount of time. We've taken a dosage that is higher than we need to take. But in general, these effects are non-life threatening and can be avoided by practicing informed consumption. So we have our mild effects, which a lot of us are familiar with: the dry eyes, dry mouth, red eyes even. Some folks experience dizziness or lightheadedness, especially with THC consumption. There's coughing with those inhaled products. Some folks experience nausea with high doses of THC. And then again, mood changes. So with lots of doses of THC, you'll get, high doses of THC, you can get that anxiety or paranoia that begins to set in. However, you may also get euphoria. So, and it depends on which end of the spectrum that you're going for with the effects that you're trying to achieve, because for some folks, euphoria and or cognitive impairment is exactly what they're trying to achieve. When we look at moderate effects, for example, those, again, we have that euphoria in there. Depending on your timing and environment, that may not be something that you want to experience. You may experience some blurred vision and even headache. And then as we move into our more serious side effects, that tachycardia, the racing heart, we have orthostatic hypertension that may occur. The cannabis does work to dilate our blood vessels. So there's some information there that we want to be cautious of, especially for folks who are already taking blood pressure pills, for example. Paranoia or psychosis, which we've already mentioned, depression, and then a new phenomenon, we have cannabis hyperemesis syndrome that we're seeing quite frequently for those folks who have a genetic mutation that causes them to have this response to cannabis. But again, generally not life-threatening and can be mitigated by practicing informed consumption. All righty, next. All righty, so these are just some very brief special considerations, and honestly, we could probably have a slide for each one of these things, but something that you want to keep in mind when you are working with patients using medical cannabis is that they can access this regardless of our input or not. And a lot of times that's how it's going. It's not happening with a lot of oversight from healthcare professionals, which is why it's important for us to educate ourselves, be mindful of the information that we have and that we're sharing in the context of what we do and do not know. And generally, even if you're not advocating for this patient to take medical cannabis, we should always be trying to take a harm reduction approach when we know that our patient is consuming cannabis. And, at very least create an environment where the patient feels comfortable discussing this alternative therapy with you as their healthcare provider. We have contraindications groups that we know that we should avoid or use caution with in terms of using cannabis. Pregnancy and lactation is definitely one of those. We have lots of inconclusive studies on the effects of cannabis on the unborn fetus. However, we know that cannabis and cannabinoids does cross the blood-brain barrier and enters into the placenta. We know that it's also transferred into breast milk, which gives a lots of opportunity for it to be passed on to our infant. For those folks who have a history of psychotic issues, in particular schizophrenia, we want to be careful about using cannabis, as it can exacerbate some of the symptoms associated with those conditions. We already know that cannabis can cause tachycardia, for example. We know that it can induce hypotension because of that blood vessel dilation. So if this person has cardiac issues, we want to monitor them closely. with COPD and asthma. We want to make sure that they are using an alternate method of consumption, as inhalation might be aggravating to them. Those with substance use disorders, we want to make sure that they are not in a situation where cannabis can be used as a gateway gateway to other substances, and want to make sure that we're always using it from a harm reduction standpoint. And then the same with immune disorders and folks that are on blood thinners. A lot of times, because of the way that cannabis is metabolized in our body, it has the same warning as medication with a grapefruit warning on it, for example, in terms of how it can be harmful to those that are taking blood thinners. So if we have any patients that any of these contraindications apply to, we want to monitor what's going on with them in terms of their cannabis use. In terms of drug interactions, most medications can be safely used with cannabis. However, we do have concerning interactions with those drugs that are CNS depressants and those that are metabolized within the liver with that P450 family of enzymes. A lot of times, if you take the medications together, you can end up with either an increased or a decreased effect of cannabis, or vice versa, increase or decrease effect of the medication. And a lot of times this can simply be mitigated by spacing out the timing in which the folks are consuming cannabis versus taking their prescribed medications. In terms of cannabis use disorder, while we have evidence to say that cannabis isn't necessarily addicting, we do have folks that may misuse cannabis, that they're choosing to consume cannabis regardless of their financial circumstance or perhaps of their social circumstance. Maybe cannabis is getting in the way of their family interactions, or perhaps them holding a job, for example. We need to be aware of what that looks like, be aware of the risk factors that contributes to cannabis use disorder. And last but not least, we know that we are in a very interesting space as it relates to cannabis. It's not federally legal. However, it's legal here in the state of Michigan. Overall, we're just telling folks to be mindful of the rules under the institutions in which they practice. Most facilities and institutions are in the process of developing policies related to cannabis care. So everyone that is working under a health system should become familiar about those policies, inquire about them before they begin certifying and educating patients on medical cannabis. All righty, next slide. Okay, so we're down to the last end of things. We wanted to provide you with a little bit of more resources for education and outreach to just continue your journey on learning about medical cannabis. We obviously have that report that you want to take a look at. And then some of those articles that we mentioned that really kind of provide some of those practical guidelines. We even have our Federation of State Medical Boards and National Council of State Boards of Nursing, our governing bodies, who have guidelines on how we should approach patients using medical cannabis. We also have a couple of organizations that you can access to learn more information. So the Americans for Safe Access website is always great. It has a bunch of tools for both the healthcare provider and the patient in dealing with medical cannabis. We have healer.com, which has some courses that are designed specifically for healthcare providers to learn a little bit more in depth about medical cannabis. We also have STEM, systematically testing the evidence on marijuana, which is where we got that snapshot of the literature reviews for chronic pain from, but it's a great succinct place to keep all of the most current evidence about medical cannabis that you can tap into. And then we'll go to our next couple of slides, if you will. Those are references. Tess, I think the next slide is references as well. And then we're at the end. So thank you again for being attentive throughout this chat. We have our post-test, which is very similar to the pre-test, just to get an idea of how effective the information was for you today. The link is also in the chat, and it's been a pleasure chatting with you all today. We'll open it up for any questions that you may have.
Thank you so much both for that informative presentation. We're going to open it up for Q&A. I know we're right at 1 o'clock, so if anyone has to jump off, we completely understand. But I did want to have the opportunity to answer a couple of questions. And as a quick reminder, the webinar recording and presentation slides will be available on our website, washtenaw.org/marijuana, in the coming weeks. I've already had a couple questions about that. I did want to kick us off with just one question about dosing. It seemed like an important theme that you mentioned throughout the presentation, just finding the right appropriate amount for people. And I imagine that doctors nowadays that marijuana has been recreational marijuana is legalized in Michigan. I bet more patients are disclosing to their providers that they are self-treating or using marijuana. How do you start a conversation with folks about dosing who might not have any background in that?
Absolutely. So one thing that we always emphasize is that everybody has their own unique endocannabinoid system. And what that means is that each dose, each product is going to affect us all differently. So that's the first thing. You know, what your neighbor takes is not going to be the same thing that you take. The effects that they get from, you know, their particular product, you might experience something completely different. So that's kind of where we start, so that folks have a baseline understanding of that. And then we move into the concept called microdosing, which we talked a little bit throughout the presentation. And that, in layman's terms, means start low, go slow. So we have those small, minute amounts of cannabinoids that we will introduce over time. We tell people, hey, you know, if you're going to start with 0.5 milligrams of THC, you know, let's say you've already trialed your CBD and you want to try some THC now. You're going to start with a very small dosage of that, and you're going to track your symptoms. We also encourage folks to keep a log of what they're taking it, when they took it, how it makes them feel, if they have any adverse effects, and that way you can kind of gauge, you know, where you need to move from there. But generally, you'll start slow. You'll keep on with that dosage for 2 to 3 days. If it's working for you, absolutely wonderful, you'll stay there. If you're saying, hey, well, I'm still experiencing nausea, I'm still having my pain, you'll slowly increase that dose until you hit your desired effect, or you start to experience those adverse effects. So in short, it's not a one size one size fits all dosage. And then you want to start slow and up titrate until you find what works for you.
Thank you. And there was one question in the Q&A. Someone is asking, they have a patient who suffers from metastatic breast cancer with chronic pain, which has spread into her bones. What strains and dosages would you recommend to best help?
Gotcha. Okay. So whenever we are approaching a patient, we're not only looking at their diagnosis, but we're also looking at the symptomology that they are trying to control, right? So this person, obviously, we're trying to control pain to a certain extent. The next thing that we want to think about is, what experience does this person have with cannabis, right? Are they familiar with cannabis? Have they taken it before? Are they completely naive? That's something that we want to consider there. The next thing we will start to consider is what routes of administration they are comfortable with. So when we're talking about strains typically refer to the flower, the inhaled form of cannabis. However, we do have other routes of administration that may be more appropriate for this patient. So one thing that we always start with folks who are, especially folks who are naive to cannabis, is the products that are called tinctures. Those are like the extracts that can be placed sublingually. And the reason why we like to start with those is because they come with a little dropper that you can get very specific dosing in. So you can look at the dropper. It looks like if you were, you know, having a medicine cup full of Tylenol. You have those same indications on there, and you will start your same process. You start low and go slow. So when we're talking about pain, well, why is this pain being caused? Do we have inflammation going on there? Automatically, we're going to start with a CBD product. If we have something that contains THC with that whole plant profile, that would be appropriate. And then we also want to start to look at any products that have additional cannabinoids, right? If we look at CBDA, for example, it also has great anti-inflammatory properties. So if we can find a tincture on the market that has, both THC, CBD, and CBDA in it, that's a great starting place for that person.
Wonderful. And another question came in. If there is a patient who falls into some of those categories that would qualify them for medical marijuana, how do you recommend them to obtain a medical marijuana card and get the appropriate dosage?
Gotcha. So cannabis in the state of Michigan, our program requires that you not only have one of those qualifying conditions, so that long list that we saw on the funnel slide, you have to have one of those qualifying conditions, and then you also have to have a recommendation from a physician. So in the state of Michigan, there aren't any special requirements for the physician to recommend. They just need to be licensed as a medical doctor, and they will see you, review your records, and if they decide that you are a candidate for medical cannabis, they'll go ahead and provide you with a recommendation that you can turn over to the state. You fill out their application, you turn in that sheet of paper from the doctor, you pay your $40, and they will then send you a medical card via email, and then you'll get a paper one in the mail. So that means you're officially registered to be part of the program. And that card enables you to shop at licensed medical marijuana provisioning centers. And I do want to note, though, that folks can access cannabis by going to one of the recreational facilities. The products may vary in terms of like packaging and formulation, but you can still access cannabis products without a medical card. And then the last part of that question is, how do you approach dosing? It would be the same way that we would start with our start low and go slow. Unfortunately, we do not have a bunch of providers that are knowledgeable in terms of providing you with specific dosing where you should start for your ailment. So a lot of times we have folks navigating this cannabis journey by themselves. If you find a provider that is knowledgeable, by all means, reach out to them and get the process started. Midwest CannaNurses also helps folks do that preliminary navigation so that they can figure out at least where to find the products and how to start using them. CannabisNurse.com is another resource. There's a nurse, Kathleen, who's wonderful with helping folks figure out their cannabis dosing. But all in all, it's going to be a very individualized process. You're going to have to take resources into your doctor to support why you're using it. You may even have to pull some articles yourself that go into your specific ailment and what has been done in the past. So in short, you're either going to navigate with some resources by yourself, or you're going to find a healthcare provider, which at this current time is few, far, and in between, that's knowledgeable about the dosing for cannabis.
Thank you. One question came in through the chat. This might be the last question we get to. We're going quite a bit over here. Someone was wondering if you could speak about some of the issues related to marijuana smoke to the user and those around them.
Absolutely. So the evidence that we have thus far, there's no direct link with cannabis consumption, inhalation in particular, with lung damage and lung cancer. However, that does get a little bit more complicated when we think about some of the confounding factors around smoking, like what other conditions do you already have? Do you already have a pre-existing respiratory condition such as asthma or COPD? For those folks, we want to use caution with inhalation in particular, and you want to consider using an alternate route of administration. There's also another confounding factor could be, what are people using to inhale their cannabis? If someone is using a tobacco-based product, which is your Swisher Sweets that you see in your gas station or your backwoods that are very common in certain communities, you are getting that tobacco exposure, and that's something that you want to be aware of. There's another thing to consider that smoking may be more harmful to the lungs. And by smoking, we mean you're taking a lighter or flame to your cannabis, can be more harmful to your lungs than vaporizing, for example. And that's because of the temperatures that the cannabis is heated up to and that you're introducing into your lungs as well. So if smoking is a person's preferred method, or perhaps it's the most effective method because it has that rapid onset, we start to introduce harm reduction methods like using a hemp wrap or using a vaporizer that doesn't heat the cannabis high temperature that causes the lung damage.
All right, thank you so much. I think we could go on and on all day about this. There seems to be a lot of interest from our audience, but I think we're going to wrap it up here for today.